Do you find yourself struggling to regulate your emotions, feeling either overwhelmed or numb? One of the biggest enemies when you're sick, especially with cancer, is being in a constant state of fear. Today, I sit down with Ellie Richter, a subconscious integrative therapist who combines the power of Psych-K and somatic practices to help you heal. Ellie shares techniques that can help you release trauma, regulate your nervous system, and bring you to a state where healing is possible. You'll want to stick around until the end to learn a powerful exercise you can use to tune your vagus nerve and bring your mind, body, and soul into harmony. You're listening to the Born to Heal podcast, and I'm your host, Dr. Katie Deming. After 2 decades of practicing as an oncologist and caring for thousands of patients, I've seen firsthand how our healthcare system places obstacles in your path to true healing. My guests and I will bridge the worlds of Western medicine and alternative healing to help you achieve optimal health. Expect to uncover new insights, share a few laughs, and maybe even shed some tears along the way. But most of all, we'll learn how to heal from within together. So let's dive into today's episode. I am thrilled to invite Ellie Richter, who does subconscious integrative therapy, to the show. Ellie, thank you so much for being here.
Thank you so much for having me.
So, I want to just jump right in. And actually, I would love to hear how you landed in this work. Like, what was your path to coming to subconscious integrative therapy?
Yeah, I love telling this story. It's been a windy road of experimentation, of trial and error. And as you can hear from my accent, I'm from Germany, and Germans are known for being very academic and precise. So that's kind of like what I grew up in. So most of my life, I thought I wanted to be a doctor because I always knew I wanted to help people. So I was very much subconsciously brainwashed to believe that the way that you help people is you become a doctor. I ended up choosing physical therapy and went to college for physical therapy in Germany. And during that time, I discovered that what people were complaining about, I already sensed that it was way more in their minds and in their emotion, and that the physical expression was really just a symptom, not necessarily the root cause, but I didn't have the words for it. And actually, when I was 19, I went on a vacation with my mother and discovered a book that was probably similar to the book The Body Keeps Score, which is one of the profound books that talks about the connection of trauma and your subconscious and your emotions and your physical health. And that book had a huge impact on me. And based on that book, I became a physical therapist. And then when I met my ex-husband, he's American, I fell in love and followed him to the States, and my degree wasn't transferred. Initially, I was a little bit angry, but then I realized it's an opportunity, and physical therapy, you see three patients in an hour and 8 hours a day, and it feels pretty ineffective, And I was really eventually appreciative to have an opportunity to start again. So out of my degree and what I've already had learned, I was kind of like pushed into entrepreneurship at age 23 when I immigrated. So I started as just teaching classes, and I had become a fitness trainer during college in Germany to earn a little extra money. So I was able to teach classes, do personal training, and I realized I can bring my physical therapy knowledge into the personal training, become a holistic personal trainer. But I always in the back of my head had this belief that wasn't good enough because it wasn't academic enough. So I went back to college in Charleston, South Carolina for health education and psychology. And during that time, I went deep into spirituality. I had a spiritual mentor. I stopped drinking alcohol. That was at age 25, 26. I started to really discover myself. And I really liked what I was doing with him. So I became a life coach and combined all my knowledge that I had from my college degrees to helping people more holistically through initially it was with health, through their health issues and their weight issues. But then I realized it's really all of life. And I became trained as a life coach, did several certification in Ayurveda, meditation, and started to really work with people deeply on helping them change their life and change their behavior. And whenever you work with people on behavioral change, you eventually come up against a huge block. And that's their subconscious mind. You know what to do. And then why do we know what to do and don't do it? Why do we keep not following our intuition? Why do we keep abandoning ourselves? Why do we keep betraying ourselves? So I got really curious about how I could keep helping myself and others. Because in 2017, as it so goes, life has kept pushing me into discomfort and trauma and challenging situations. My marriage had ended. My dad passed away. The house I was living in had black mold. So there was a lot of things that just started to like unravel. And I realized I need more resources, and I keep bumping up against the trauma that I thought I had already dealt with, you know? And I realized that the tools that I was using, it was kind of like going to the dentist with a broken leg. You know, it was nice. The dentist would say, I understand you're in pain. That was nice, but the tools weren't really working, you know? So I had accumulated a lot of feel better tools, but not get better tools. And I like to, you know, with all due respect, I think talk therapy is very much a feel better tool, but the get better tool was missing. The working on the underbelly, the root cause for our emotional pain, for our physical pain, for the way that we're acting and showing up. So I found Psych-K, and the minute I found it, my life changed. I changed my entire praxis the next day. All my coaching clients were now subconscious integrative therapy clients. And then I realized everything I learned so far is still super valuable. It's just all clicking it together. And that's how I combine somatic practices. So the nervous system care, working with the vagus nerve, helping you to feel better day to day. And then the subconscious practice is really helping you to get better, upgrading your software and combining the two to give people a really integrated, holistic approach to their mental health that is also very empowering. So it's not dependent on the practitioner or, you know, but it's like you are resourced, and I hope to resource my clients so much that they feel empowered for the rest of their lives to handle anything that comes their way, and also to really step into their magic and their gifts.
I love that. Well, and I think also for our listeners who, you know, may not be as familiar with the conscious and subconscious mind, it's like, you know, talk therapy and doing things that we are consciously aware of is conscious, you know, affecting the conscious mind, but that only affects 5% of our behaviors and our thoughts and actions, where 95% of our behaviors, actions are driven by and beliefs by the subconscious mind. And so I love that. I love the analogy of going to the dentist with the broken leg, because it's like there are these different pieces. And also I love how you said the feel good work versus the get well work, and having those two. And also what I love as you describe your work of integrating the somatic work with the subconscious work, it's like you're using something that helps them feel good in the moment, the somatic nervous system work, so that then they can do the work of the subconscious to get better as well. So combining those two is really beautiful. So I wonder if you could tell us a little bit about that integration of the two, the somatic and the nervous system, and why also regulation of the nervous system is so important as you're doing this work on the subconscious level.
Yeah, I actually love to piggyback on what I just heard you say. I do it the opposite way. When somebody comes to me in great distress, the first thing we'll do is subconscious work.
Oh, interesting.
Because when you're in distress, you can certainly, when you're alone on your own, I teach you how to do somatic work. So if you're not trained in subconscious work, your best first choice is physiology first, working with your nervous system. Now, if you can work with Psych-K, if you're trained in it or you have a facilitator, my first choice whenever I'm encountering anything is Psych-K and working with my subconscious mind. And here's why. With Psych-K, within seconds to minutes, you can completely come out of a trauma or a stress and you're out of it. With somatic care, it's sort of you're treating the symptom, but then it comes back, you know? And here's why. The subconscious mind makes, as you know, 95 to 99% of our entire consciousness. Now, this part of our consciousness actually governs our nervous system and our physiology. So the governor to the autonomic nervous system is the subconscious. So the autonomic nervous system responds to what's going on in our subconscious. So a lot of people don't know that they're living with constant stress that constantly shows up in the nervous system. And the nervous system always responds appropriately to our subconscious programs in our environment. And people know about the nervous system by knowing about the fight, flight, freeze reaction. You know, that most people have that understanding. We have this automatic animal instinct nervous system that keeps us safe. Now, there's an expression called window of tolerance when your nervous system is nicely humming and you're regulated and you're not in fight, flight, freeze. You have plenty of bandwidth and you're inside of the window of tolerance. Now, a couple of symptoms when you're inside of the window of tolerance: you're sleeping well, you're pooping well, your mood's stable, your emotions are stable, you can handle stress well, you can have tough conversations, you can show up for the things, you don't drop balls, So being inside of the window of tolerance is a great place to be. And most people's issues, believe it or not, are because they're outside of the window of tolerance and dysregulated. So once you leave the window of tolerance and you come to the edges, that's when you get reactive. That's when you shut down. That's when you start to blame other people, or you are so overwhelmed that you can't respond to a text, or you experience anxiety, or in like really strong cases, you have depression and panic attacks, can't sleep, and all these disorders that then people show up as a therapist's office or doctor's office is basically our nervous system dysregulating symptoms, right? It's like the seven heads of the Hydra. You know that story of the Hydras?
No.
Right? The Greek mythology story where there's the monster is the Hydra and it has seven heads. And every time you try to cut off one head, 10 more pop out, basically. And that's how it is with treating somatic symptoms. You start with the gut health and then you discover there's this and then there's that. Because our nervous system connects our brain, our heart, and our gut through the vagus nerve. The vagus nerve is the most important, longest nerve. And working with the vagus nerve directly, you can help yourself feel better and get back into the window of tolerance. It's amazing. However, if you don't also go to the governor, the subconscious, and clear the emotional, basically junk we have accumulated through our lives, the constant stress in your nervous system will always be there. I'm a perfect example of that. Like, I started using somatic practices, breathwork, meditation in my mid-20s, and now 46. And until I found Psyche and subconscious integration, it was almost a full-time job to have to regulate my nervous system every day, because I was living with several unresolved capital T traumas in my subconscious that were constantly moving through my physiology and my nervous system, even though I was every day doing the Feel Better tools. But the Feel Better tools didn't go to the root cause to nip it. They just helped me manage my symptoms. And to be honest with you, Katie, at some point I was so tired of managing my symptoms. I got so cynical and depressed that I almost said F this to all of it, And then through some divine intervention, Psyche found me, and that changed everything, because I was developing and expanding my conscious mind and my spiritual mind, but never updating my software. So eventually that disconnect felt like a constant push-pull in my nervous system and in my behaviors. So all of that said, when you have unresolved trauma or negative beliefs, they show up in your nervous system. Your nervous system is supposed to do that. It's supposed to react with stress to bullshit, basically. Negative beliefs are bullshit. So your nervous system says bullshit, and reacts with stress. So we just been so conditioned to look at nervous system dysregulation as something wrong and the pathology. And that's my number one criticism with the mental health space. We're pathologizing the human experience when really your nervous system reacting to trauma and to the insanity that's going on around us by giving you anxiety is appropriate. It's not a pathology. It's your body telling you exactly where to go and what to do. And I love that through this work, people feel safe enough to start to listen. They start to feel safe again in their bodies and nervous system to be able to listen to their bodies and to be able to actually say, I'm here now and I'm listening and I'm following you. And that's what I think is the most profound outcome, to bring mind and body again together and not so much at war. So I know I went a little bit around, but I hope I answered your question.
No. Yeah. And I love that. And also when I was listening to you describe your experience, I'm like, this is why it's exhausting, is that it's just physically exhausting. And this is why ultimately trauma impacts our body physically and we develop illness, is because it is exhausting. Even when we think like maybe we've talked about this and resolved it on a conscious level, if it's still running in the background and you're constantly fighting that and activated your nervous system, your sympathetic nervous system, it's exhausting. And then I love how you said that this is like, it's appropriate actually that your nervous system is bringing this to your attention to let you know, hey, there's something here that needs deeper healing. And so I love that. No, all of that was really helpful. And I think, you're the second provider that I've had on to talk about Psych-K. And the other one describes exactly what you said, that he went to a 2-day workshop and his life changed on day one. Like after day one, he went home and he was changed. And so I'm wondering, can you describe to us, like, what is that is happening, in this training that is so profound that it shifts like that? And also, I mean, now you probably see it in your practice, because I see it when I send clients to do Psych-K. They'll have profound shifts in one session. And they're always like, well, you know what? I've done therapy. I've done all these things. And then it's like, wow, it really does shift things so quickly.
Well, it's hard to describe it. It's kind of like if you ever done plant medicine or something, how do you describe a shift in consciousness? So I'm going to attempt this as best as I can from a more left brain perspective and then a right brain perspective. So from a left brain perspective, what we're doing is we're increasing blood flow to the neocortex and the hemispheres so that the hemispheres can come online again and communicate and have more bridges over the corpus callosum so you can access more of your mental resources. So you're in a state of super learning. So when you're basically in Psych-K there's about 10 or more different processes of super learning. They involve sometimes breathwork, sometimes the whole brain states, sometimes different techniques that you might know from other modalities, but in a combined in a new way, so that the person that's using these techniques can go into a state of super learning and within seconds to minutes shift the perception of an event or of a situation. And when you change your perception, it's a miracle. The definition of a miracle is a shift in perception. So when you not just realized, oh my gosh, it wasn't my fault, but not only that, it happened for me. And not only that, I'm good enough. And not only that, I'm lovable. Not only that, there's nothing wrong with me. You can never go back. And it's not just that it sounds like a nice idea, but because you're integrated into your subconscious and because your subconscious governs your body and your emotions, you feel it to be true. The difference between conscious work and subconscious is your subconscious governs your emotions, not your conscious. So you can consciously tell yourself, I'm good enough. And that sounds like a nice momentarily relief. Yeah, of course I'm good enough. But you don't feel it right here in your cells. And why not? Why don't we feel these nice ideas? Because our subconscious governs our cells and how we feel, not the conscious. The subconscious governs our cells and how we feel. So when you have a new belief like I'm lovable or I'm good enough or I'm forgiven, every cell of your body is relaxed. Every cell of your body vibrates at that frequency. If you close a trauma loop that you've been living on for 50 years, 30 years, a week, 2 weeks, 2 years, and suddenly that stress from that event and that perception that you used to have, we have a perception of a trauma that immediately gets us into that same emotional state. Once you release that emotional state, that becomes wisdom. So a memory without the charge of the emotion has wisdom. So out of the sudden, again, you have the wisdom from that, you're living your wisdom now, like you closed, I imagine, that trauma loop from what happened. And now it's become wisdom. It's so integrated. It doesn't hurt you anymore, but it's empowering you now. And that's why people feel so much better right away, because you're working on your entire consciousness, not just your logical part or your muscles. Your entire consciousness shifts and permanently shifts.
Yeah, no, I love that explanation, actually. And one thing that you said in there is that it's, you didn't use this word necessarily, but it creates, you said, like a shift in the feeling that they have, but it's like experience. As human beings, we learn through experience. And this process gives them a new experience in their body that then they now are imprinted, and that's programmed. And it's something that's almost hard to explain. And you're right. I, through the past year,
have used PsychK. So PsychK was the modality that I used to heal a whole bunch of trauma, not just my trauma of leaving Western medicine and getting a divorce and having the shared death experience, but also stuff from my childhood as well. And it's fast and there's so many layers too. One of the things that I found is that, I can send clients and they can have one session and actually make tremendous progress. But for myself, I went deep and I was like, okay, now what's the next layer? And then the next layer, just to keep going to get to that place to clear as much as I possibly can. And I think this is one of the things that is, as I've moved out of my traditional practice into this space and talking a lot about emotions and a lot about trauma, a lot of people don't want to talk about it and are afraid. And like, you're saying this is my fault, or, oh, so now it's my fault that I have cancer. Like, it's not enough that I have cancer. Now it's my fault. It's like, no. We are all getting traumatized by so many things from the world that we live in, and not our family is not as at fault. They're also reliving their traumas. And so it's just this recognizing that we all have these things and that there are tools that are amazing that can help move you through and move through quickly. So I love hearing all of that. I love how you explained that you corrected me on that you use, the PsychK first, the subconscious work first, and that the somatic work, the feel good stuff is more for people to do on their own. But clearly when you have an experienced practitioner with like yourself, the first work is start to get working on the subconscious. But I'm wondering if you can talk about how you're integrating those two and what does that look like in bringing the somatic work into your PsychK practice? Hey, it's Dr. Katie. You may have noticed that I talk a lot about water on this podcast. After a year of research, I've learned that optimal water needs 3 key elements: filtration, mineralization, and structure, just like natural spring water. Doing all these steps to my own drinking water took me several hours a week. That's why I'm so impressed with Spring Aqua. Their system incorporates all 3 elements in one system that is basically modeling its technology after the renowned healing waters of the spring at Lourdes, France. I personally use their Wet 7 model, which offers alkalinized hydrogen water and saves me hours each week. Spring Aqua has dramatically improved hydration for both me and my family, and I believe it could do the same for you. I recently had the owner, Kenny Liu, on the show, and his integrity really shines through in this product. If you're interested in experiencing truly hydrating water that mimics nature's process, please visit the link in the episode description. Yes, to go back, before I started PsychK and this work, I was already a holistic life coach and I was already working with people on all topics. So I had people come to me for health, for career change. I work with a lot of entrepreneurs, a lot of therapists and coaches come to me. Lately, I've had a lot of doctors, which is really exciting, So a lot of entrepreneurs, a lot of leaders are coming to this work to change any areas of their life. And then I added PsychK, and so it kept going that I don't have a niche. People come to me with all kinds of things, and usually, referral, Instagram, whatever it is. And then the way that I integrate it is I teach people how to take care of themselves. I call it flexible discipline. And as a holistic life coach, all I did is teach people flexible discipline. So basically teach them good habits based on their energy type. I integrate what's called human design. I wrote a little book about it. WTF is human design. So people can introduce themselves. It's basically an archetype type understanding. Amanda and Jess, who you're working with and know, they're working with the Gene Keys and human design. And so let's say you come to me and I look at your human design and your Gene Keys, so I understand what lifestyle would be ideal for you. So my lifestyle is ideal for me, but not for you and not for the next person, And so I help people with these somatic tools and with understanding of human design to also empower themselves in their day-to-day to really change their lives. Because the truth is, and what I see as one of the biggest issues, is victim mentality. We go to doctors or to practitioners or to therapists and we're like, fix me, instead of realizing we're not victims, we're lighthouses, we have to participate. Nobody's saving us. Not Psych-K, not somatic tools. We are the medicine. You are the powerful healer. And you can use these tools and resources, and people are here to support you. But ultimately, we have to come out of victim. So I've noticed that people sometimes, because Psych-K is so mystical and magical, and they're like, oh my God, if I can just reprogram my subconscious, I don't have to do anything, you know? I've noticed that that sometimes sneaks in. So I'm very clear, like Psych-K is a resource, and that's very powerful. And you still have to show up and change your life. You still have to speak up, set boundaries, do what you love, you know, take care of yourself, move your body, eat well, you know, all those things. So that's how I combine it. I help people create a flexible bliss discipline with healthy rituals and healthy self-care so that they stay connected to themselves, that they continue to expand their consciousness and to continue to really grow and make lasting and sustainable changes in their life, not just a temporary, like, you know, have a quick session, but I like to see it through and work with people over a couple months or a year to really see the change all the way. I have plenty of people that just come for quick, you know, updates, but the big magic I see with people like you know, where you're there and you're really building on these practices. So I provide people still with the same benefits they get from a coach, the habits, you know, really building healthy habits and stepping into their zone of genius, but doing so by making sure you have the program first. So that's not hard, because in traditional coaching, what I notice, it's really hard to slay all those fears and to take action while you're operating on trauma. So it's possible. Anything is possible with willpower, but it's hard, right? It's hard to build a business. It's hard to make a change with behavior changes alone. So I love to combine both of that. I teach people the best of the best somatic tools that I think. I don't think they have to be complicated. One of my favorite is the vagus nerve basic exercise, where you just tune your vagus nerve. I can teach it to you right now if you want.
Yes.
Yeah, that's one of the things that I right away, so that people feel resourced with just the best things for them, know why, and then for the rest of their lives have the right resources. Because the truth is, for the rest of our lives, we have to do things differently. If we want to maintain optimal health and well-being and consciousness and our depth in relationships, the spiritual connection and meaning, being present is an everyday choice and an everyday practice. So I like to resource my partners, my clients with the practices so that they can do that, you know? So while we're working with Psych-K in session, I'll also teach them little tools, and they also can message me between sessions when they have questions. And that's usually how I teach them the tools. And I have a couple of videos, you know, like here, do this, do that, body scans. And I think those tools are really important. However, when you teach just behavioral tools without also updating the software, it's hard. It's hard to change your behaviors without changing your beliefs, because your behaviors are literally a printout of your software. Your behavior is a printout of your beliefs. Like if you grew up eating unhealthy foods, that's your subconscious program. So trying to eat healthy is going to be every day a hard battle. You can totally do it, but it takes about all the energy you have to not eat the cookie, you know, and then eventually after a couple months of gruel, it might become your new normal, but every time you get stressed, hand is back in the cookie jar. Now, when you do subconscious change first, and along with that, all of that will feel so much easier because it's actually already your software, and you don't have to fight so hard against your priming, you know?
Yeah.
Did I answer your question how I'm combining?
Yeah. No, I love that. And actually, so I want you to teach us the tool, but before that, so this whole thing, this was in 2020. Yeah. The fall of 2020, I enrolled in the life coach school. I didn't necessarily think that I wanted to be a life coach, but I was like, it would be really great to learn these tools and, you know, just go deeper with it. So I enrolled at the life coach school. Like 4 months in, I was like, this isn't it. Like, I didn't know what it was, but I was like, this is hard. Like, and I see people getting like amazing results. Actually, a lot of friends who are coaches who were trained at the life coach school, but something in me just knew that this wasn't it. And I don't know why. When I decide something's not aligned, I just quit. And so it was like, even though it was like some crazy amount, like $18,000 or something, I was like, 2 lessons away from finishing. And then I would have just had to like stay in for 6 months of like weekly calls or something. And I was like, I'm out. And I just left. And then now that I understand the subconscious, I understand like I was recognizing that that wasn't it. Like you said, it's hard. If you are fighting the program, you can do it, but there's this whole piece that's missing. And it's a big piece when we're talking about 95 to 99% of everything is our consciousness is driven by the subconscious. So I wanted to say that because there's these things that we know, we just don't know what exactly why. And so it's interesting with that piece. And then also, I think it would be really good for you just to briefly describe what human design is so that people know, because we definitely have not talked about that on the show. So I think giving a brief introduction to that, and then I'd love to do the vagus nerve tuning.
Hell yeah. And, I love that you had that experience, and that's so your human design that you basically knew it's not working and you quit. I love that so much. I love that. And I don't know you very well, but I love you already, because to me, that's a true, like, masterful skill to know what's not for you and then to not even stay obligated. Good for you. Good for you. Human design is a bit woo-woo. So I recognize also this audience, so this might stretch you a bit, but it's been also around for about 3 decades. And it's kind of a self-awareness tool that gives you a blueprint and an understanding of your energetics. And there's 5 different archetypes, and each archetype is very different. And then under each archetype, there's so much information that just really helps you to discover your purpose, what lifestyle is best for you, how you best manifest, what's the qualities about you, your gifts. You get to discover so much about your gifts. And I discovered it in 2016 and really helped me to understand myself. And it helped me to be way more in alignment with what's right for me, all the way from lifestyle to my business. So I can highly recommend it. I wrote a little introductory book about it that you can get on Amazon just to get sort of like the skinny on it, so to speak. It's called WTF is Human Design. And I talk a lot about Psyche in that book as well, because once you discover human design, you also discover how deeply programmed you are, how deeply brainwashed you are. And many of us are brainwashed to be someone that we think we should be. I thought I should be a doctor. My dad always told me, this is my daughter, Elizabeth, she's going to be a doctor. And so I had this program that I should do something academic. And I told you how much that program really impacted me. And I had 2 college degrees later because I always thought that's what I had to do. So human design helps you very clearly to become aware of how deeply programmed you are and in which way, and then how you can unlearn all that to become your most authentic self. It's really fun. It's a really fun and very meaningful, but also very shadow worky, confronting material because it's powerful.
I love it. Well, and I just recently kind of learned about human design. And I will say that the one thing that was super helpful for me as a generator was just learning that I should respond to things, wait for things to come to me, and then respond rather than initiating things. And this was huge for me because my whole career and life, I've been just making shit happen, just like forcing, and I've got like a lot of will, and I can use my will and I can get stuff done, but it felt so hard. And what's been freeing about knowing that part of my design was just like, oh, I can just respond. So now as things come in, and I love that. Actually, I love like that you put that together with the life coach school. It's like, now I just know in my gut, I'm like, I know when something's right or wrong, and I just go with that. And that's really how I live now. And it's been so freeing and also like less tiring, than trying to make things happen that aren't necessarily meant to happen. So I love that. Thank you for sharing that. And I love that you had that book. I'm going to check that out because I don't know very much about it myself. So do you want to do the Vegas tuning with us?
Oh, yes, absolutely.
Yeah.
Okay, so this exercise, I'm going to actually give credit where credit you. So if you're a practitioner and you're listening, or if you are dealing with cancer and you're listening, or if you are just wanting to start somewhere, this tool is something that can help you, especially compounded if you use it every day, multiple times a day. It can help you come out of dysregulation. And Stanley Rosenberg, who wrote the book, Accessing the Healing Power of the Vagus Nerve, he came up with it. and very, very skilled hands-on therapist. So let's do the basic exercise. Normally, when you do it the first time, you want to lie down for it, just in case your body responds, So if you are listening, I invite you to lie down. And since you and I are sitting and we're not going to fall over, and it's really not dangerous at all, but just in case, we want to start by bringing our hands behind our heads and relax the shoulders. And we're only doing that to support the head so that it doesn't move, because in a moment we'll look to the sides. So you don't want to turn your head or your heart. So you keep your head perfectly still, and then look to the left, to the right, just parallel to the floor, and gently breathe until you yawn, sigh, or swallow, and then say, okay.
Okay.
Okay. And then you can close your eyes and just allow yourself to notice the difference between the right side and the left side. Notice any sensation. You can also relax your hands in your lap right now and just kind of notice and tune into your body and see if you can even feel the anatomy of the vagus nerves, your brain connecting to your heart, connecting to your gut, and your gut connecting to your heart, to your brain, the cohesion. And then when you're ready, bring your hands behind your head again and look to the left. The same thing. So you don't turn your head, you just look to the side until you yawn, sigh, or swallow. And the yawn, sigh, or swallow is a sign that your nervous system is shifting, downshifting, back into a parasympathetic state, into the state of rest and digest. So you can do this exercise first thing in the morning while you're still in bed, and every single time you go to the bathroom. And you always want to wait for the yawn, sigh, or swallow. And then when it comes, just say, okay. Did it come? Okay.
Okay.
Just give yourself a moment to tune into your body so that you can just in a moment report back to what that felt like for you. Super easy.
Yeah, it was really easy. And also like I felt it. And what was interesting, and I can see the doctor part of me was like trying to figure out like, well, if it's this side of the brain, but when I looked to the right after that and tuned into my body, it felt relaxed on the right side. And I was worried like, well, if I was doing the right side, shouldn't be the left side of my, anyway, I was overthinking for sure. But I did feel that like a relaxing, just kind of like a decreased tone almost.
Yeah.
And I noticed it more in the right side of my body. And then as I did the left side, it just felt even and like relaxed. That's what I felt inside.
Beautiful. Now, I want to speak to this a little bit because I'm the type of person you tell me, hey, do this and it changes your life and I'll do it. But if I know the science behind it, I'll do it even more, Yeah. So the science behind this is think about like, and comes all the way full circle back to my physical therapy degree, my first passion. My first passion was physical healing and the fact that our body is divinely intelligent and is already whole and perfect. And we are already whole and perfect and already know how to be well. And that there's certain things we can press or adjust in our system to get better. And the vagus nerve is one of them. And working directly with this nerve is so empowering because it brings your brain, your heart, and your gut into cohesion. And when the vagus nerve is not operating optionally, then we have those 7 heads of the Hydra issues. We have gut health issues, migraines, neck pain, heart palpitations, anxiety, like all the things that can all be traced back to a dysregulated nervous system, including like codependency or addiction, including those type of behavioral things. So this is almost like you're turning on the flip in a fuse box, in your house when the light's off. This is exactly what you're doing in your body. Boop, you're turning on your physiology. And then you can come back into that window of tolerance that I mentioned earlier, and you can handle life better again. You can come online again. You feel more peace, more relaxation. You're not so hypervigilant or depleted that you can't function. You're coming back into your energetics. So do this first thing in the morning. And then every time you go to the bathroom, and why don't you go on your personal experiment with this and we'll talk again in a week or 2 and you let me know. I've seen so many great changes combining this with Psych-K, especially when it comes to addiction. I work with a lot of people with addiction, whether that's eating disorders or alcohol addiction or other form of symptoms of trauma. Addiction is a symptom of trauma. It's been profound. So this vagus nerve, when it's dysregulated, it creates all kinds of chaos in the body. And when it's nice and toned, it creates naturally a state of harmony and helps the body restore homeostasis. It's so much of the therapeutic approaches when your vagus nerve is not working, it's almost like it can't really take a hold, you know? And then once your vagus nerve is actually working, the therapeutic approaches are working better. So whatever you're doing right now, wherever you are, however, who's listening, do this every day. It's so easy. Everybody can do it. Kids love it. All my clients, kids love it. And like, here we do the basic exercise, you know, and I call it frequency tuning because we're always looking to be in the frequency of that which we want to embody, right? And so if you're dysregulated, if you're depressed and you can't be social and connect because your system is so dysregulated, then we can't embody the frequency we want to be in. So this is a real big game changer. And together with Psych-K, I think they go so beautifully hand in hand because with Psych-K, you help delete the trauma and unpack your emotional garbage backpack. You know, every time we feel a feeling we don't want to feel, we put it back there. So we can unpack that with Psych-K and can help you have a new set point in your nervous system. From set point of anxious, you can get to a set point of peace. A lot of people say, I'm just an anxious person. No, you're not. You're just living with a lot of dysregulated, you know, unresolved trauma that's just regulating your system. So you can create a new set point. And then with the vagus nerve toning exercise every day, you can not only stay in the window of tolerance, but build it. And then imagine what happens when you stay and build your window of tolerance, the amount of leadership you can step into, the amount of joy you can experience, the amount of pleasure you can experience, the amount of generosity that you can give with, the amount of access of solutions that you have and consciousness that you can operate on to give, to serve, to connect. It's the best.
Well, and I think this exercise for my listeners is really powerful. And especially if you're dealing with an illness and particularly with cancer, because one of the biggest enemies when you're sick is fear. People are in a constant state of fear. And this is one of the things that I talk about a lot. We have to get out of fear because healing doesn't happen in the body when we're in a state of fear, and we need to get to peace. And so this is a tool that Ellie just taught us that you can use, and everyone should be using this tool. So I'm going to be using this. And I have a question though. Why after each time you go to the bathroom?
Oh, just because I love that you asked, and thank you for asking that. Sorry, sometimes I'm so excited that I jump over five little steps. When you try to establish a behavior, it's always good to couple it with something you're doing regularly.
Habit stacking.
Yeah. So you're just stacking it. Exactly. Okay. So in the bathroom, because everybody goes to the bathroom quite a bit, you know, that's a good time. And so a lot of my clients put a sticky note with the eyeball in their bathroom. They know to do it every time they're in the bathroom. And that's just habit stacking. Yes. Thank you.
Yeah. I love it. I was like, is there something physiologic happening when we're going to the bathroom? But no, I love that. Well, and I love that you teach it that way, because then it's just easy. You don't have to remember to do this 5 times a day or whatever. You're just every time you go in the bathroom. And the sticky note is really good. So if anyone is doing this, giving yourself a little reminder is really important, because we're creatures of habit. And until this becomes a new habit for you, you want to have those little reminders. So I love that. And I think, you know, the last thing that I'd like to ask you about, Ellie, is, you know, there's this connection between trauma and illness in the body, and people being afraid of going back and re-traumatizing. And so one of the things that I would like you to speak to is, you've said that this is simple and this is easy, but one of the things that I find is many of my clients have gotten into a pattern of suppressing emotions because it's too painful. And I'm wondering, you know, if you can speak to that. I know just from experiencing Psych-K, and you talked a little bit about bringing, you know, the superpower of bringing both the hemispheres of the brain online, but explaining just a little bit of why this doesn't re-traumatize people, why it is safe to do this kind of work in this, with this particular modality.
Yes. So what a great question. And before I answer that, would really love to highlight what I just heard you say, that the biggest enemy to healing is fear. And fear is a belief that scares the shit out of you. And the belief is just a thought we keep thinking. And not everything we think is true. And the hardest thing with fear is because it feels true in our physiology, we believe it. but it's just a subconscious belief that's scaring the shit out of us. So all fears are beliefs that can be changed. I just want to say that in case that kind of like, gets lost in all of this information. All these fears that we have, they feel so real because they're subconscious program, and the subconscious governs our body and our nervous system. Just because it feels real doesn't mean the fear is real. And that's the hard part about working with fears. And the beautiful thing is you can shift out of that within seconds, just like you can with the trauma, because what's really happening is when a terrible event happens that's emotionally charged, and we don't have the time or space to fully release the emotional charge, the subconscious keeps it, because the subconscious is the part of our consciousness that keeps score all the time, is always on, never sleeps, always records every single detail. And the subconscious mind is always in the present moment. It doesn't have a concept of past, present, and future. So when you're working with a stressful memory, or when a trauma or stressful event is still unresolved, it feels like it happened yesterday. And that's what the re-traumatizing part is. When people talk about it or visit it, then their entire physiology within seconds goes back into that event. And that's what's so challenging. And when you do that without a modality to actually solve it, it can be re-traumatizing. With Psych-K, you'll be sitting in what's called a whole brain state, where your physiology is safe, your hemispheres are open, and you get to revisit the memory. So there'll be a quick peak of distress, and then it dissipates, and then maybe a few more waves of distress. And within a few minutes, that entire event, the emotional charge dissolves like it is meant to. We're all capable and equipped and actually built to dissolve the emotional charge of events eventually. And once the emotional charge is dissolved, our consciousness can begin to see the event as what it is, something that happened in the past that cannot hurt us anymore. So the emotional charge then leaves the system. And that's why you can't, and then you can think about the event again and again and again and again, and won't hurt you anymore. People are like, I have some clients that are like, so I tried to go back in the trauma and I can't, because they're like, let me touch it one more time. Can I hurt it? And it doesn't, you can't, once you solve it, it's done. The longest somebody took to work through something was maybe 20 minutes. So think about worst case scenario, 20 minutes versus living for the rest of your life with unresolved stress. That's basically slow drip killing the quality of your life, if not your body. To me, it's kind of like a little bit uncomfortable for a few minutes versus for the rest of your life. And it's really, really safe. And within seconds, even while you're working through it, the worst is done. So it's almost like few seconds discomfort and then it resolves. I cannot tell you scientifically exactly how it works. It's hard to scientifically step by step. We just know we're working with quantum physics. We're working with a whole brain state. We've measured it. So you can see in I think EKG, right? EEG, where you see an EEG, at first a lot of stress, and within 15 seconds, homeostasis. So it happens very quickly that we can release. And I have never had a person not being able to release that trauma. Never.
It's so fascinating.
Yeah.
Well, and I think, one of the things though, and I'm not sure who explained this to me, but the whole brain state, that oftentimes when we experience emotions, we either go into our right brain and become very emotional and then feel like we're going to be overtaken by the emotions and feel like we're going to lose control, or we go into the left brain and we overanalyze and basically don't feel it and just explain it away. By doing the positioning for the whole brain state, is it creates a safety where you can experience that distress, but it feels more manageable. Even though you feel the emotion getting big, there's a safety to that, doing that with that positioning, and having the whole brain state, both sides of your brain activated, allows you to experience that. And one of the things for me that it's given me is confidence in my ability to experience emotions and not be overtaken by them, because Psych-K does take the charge out of past traumatic events. So exactly what you described is what I've experienced is I can think of the same event and it just doesn't have the same emotional charge. And I'm like, why is that? It was so like, it had me so like just incapacitated. And now it's like, I can think about it, it just has no hold on me. That's like my experience with Psych-K that I've had. But then the other thing that it's done is that when I experience emotions, being able to go into that positioning has given me greater emotional fluency to just experience emotions and realizing that, oh, when you learn these positioning for whole brain states, it makes you much more fluent in experiencing emotions since we're humans and we're going to experience emotions every day for the rest of our life. So these skills, even when you clear the past trauma, you're still learning tools that are going to help you experience future trauma and let the emotions run through and not have it overtake you and re-traumatize you in a new way.
I love that he said the emotional piece because I have several pillars in subconscious somatic integrative therapy. And one of the pillars is emotional self-regulation, learning how to parent yourself. When you're in that window of tolerance, your emotions can actually flow through again. So a lot of people, when they're living with chronic trauma, let's say you have cancer and you're in that state of like, going from treatment to treatment and just like discombobulated, you're outside of the window of tolerance. You might not even feel your feelings at all. Or you might be so emotional that you can't go through a day without flooding, So people respond to trauma exactly the way you described, either very left-brained or very right-brained, meaning you can get into a place of severe hypervigilance with trauma and become very controlling or completely out of control. And most people can identify, oh yeah, that person must have trauma when they're living out of control, when there's a lot of, you can sense there might be some addiction or their life is completely out of control. It's easy to kind of say that's probably trauma, whereas the hypervigilance is not that easy to spot as a trauma response, but becoming very controlling is also a trauma response. And when we're in that state, we don't feel. We're actually in a state of, the nervous system is in a state of frozen, right? Numb, where you're in a so-called dorsal vagal state, where your vagus nerve is in a dorsal vagal state where you can't feel. And then once you use Psych-K and you're back in the window of tolerance, the emotions actually can safely move through. And the more you unpack old stuff, the less stuff you feel on a day-to-day. So most people, when they get upset, they're not upset about the traffic. They're upset about what happened last year and yesterday and the year before and 10 years ago. And it all is like in this moment of somebody cutting us off in traffic and we lose our shit so hard that we might go bonkers. We're never upset about what we think we are. It's always like every time you have an emotion, you also feel any other emotion or any other event that was similar in nature. So the more you clear your subconscious, the less intense every emotions are, and the more you are able to stay in the window of tolerance, and the easier your emotions also flow through. That's basically how you can get rid of addictions. I've had some clients that didn't even realize they had a dependency on alcohol or used it a lot until they unpacked, and eventually they realized, I stopped drinking alcohol without even realizing. I don't need the bottle of wine anymore at night because I'm now in the window of tolerance. My emotions are moving through easier. I'm more confident in feeling my emotions and feel more equipped overall to handle life. And so I love that you brought that up, because emotions are such an interesting topic and always reflect what's going on in the subconscious. So the more your subconscious is on board with what you want and desire, the better you feel overall and the easier it is for you to navigate your day-to-day emotions.
Yeah. Well, and I love what you said about the numbing. I saw this in my practice. So my practice, I was a radiation oncologist. I treated mostly women with breast cancer. I did breast and gynecologic cancers, but it was a very common pattern that I saw with women with breast cancer. Usually with breast cancer, you'd have surgery, chemotherapy, and radiation. The order may vary, but radiation was usually kind of the last active treatment that people had before they were kind of released from the doctors and kind of back to regular life. Although it's not, normal after that, you're definitely changed. But I would see this thing that would happen is that they were like doing okay. And then we're getting right towards the end of treatment and they think that they're going to feel amazing, but they actually feel horrible. And with hearing what you just said is that they were in a trauma response and numbing. And so they weren't feeling anything. And I really would encourage clients or patients at that point to say, okay, when you start feeling anxious and depressed and all this stuff starts coming up as you're finishing the treatment, please don't push it down. Because if you push it down and don't deal with it, it's going to be like whack-a-mole coming up and like you're yelling at your kids or you're yelling at your husband or, and it's going to show up. But it's like, I didn't realize that really what they were doing was numbing because they're in a trauma response. And then finally, when they're finishing the treatment and now they have the space to deal with it, all of this stuff comes flooding in. And so this is important for anyone listening to this, is that when you finish active treatment for cancer or any other disease, you may have not been able to handle dealing with the emotions and the impact of the diagnosis while you were going through treatment because you were just busy surviving and making it through. But that this opportunity, when this stuff comes up and it's really uncomfortable and people are like, why am I not excited? Like ringing the bell at the end of radiation and celebrating. Like I see people finishing treatment on social media. I'm so excited. Why do I feel like hell? I feel terrible. I feel anxious. And it's because all this stuff is coming up. This is an opportunity to do this kind of work. And actually, that's what I do with my clients, is that if they're doing some conventional treatment, we may start to do a little bit of work if they have the capacity, but a lot of times it's not until someone finishes treatment that they can go into doing this deeper kind of work.
I so love that you exist and that you're doing what you're doing and that you're following your call so courageously. And I love that Psyche exists and these tools exist. And yes, I never had cancer, but my dad went through it. So witnessing how out of the sudden our world went from, all the distraction to acutely present. And you're so acutely present during that time, you can't go anywhere. You're just in the present, you're thinking about surviving. And then once that's done and your nervous system has a sense of safety again, and then you're slowly coming back in the window of tolerance. Yes, you might be hit with crazy ass emotion. And that's the same reason that we sometimes have postpartum depression, those types of things. Once we're through it and whatever the thing is, has happened, our body and our system is like, oh my gosh, what just happened? What just happened? And then it starts to kick in all those fears. Trauma isn't just what happened for you. It's also what we make that mean about ourselves. So this one thing I really want to say about trauma, it isn't just what happened. It's also what we made that mean. And usually when something happens like cancer, you never probably thought until you had this experience about a lot of things about yourself, but then you start to get scared and a lot of limiting beliefs form from that experience. Does this mean it's my fault? Does this mean I'm flawed? Does this mean I'm not good enough? Did I do something wrong? Is it my fault? Is my body letting me down? Does this mean my future is now colored by, there's so many thoughts that rush in that are also re-traumatizing all the time. So it isn't just the event that makes the dysregulation, but also all these beliefs that form based on that event.
No, I love that you just said that, because that is so true. And I think this is part of what I was frustrated with Western medicine, is that we make people believe that they can't trust their body, because we tell them, we don't know why you got cancer. Most of the time we say we don't know why. And then we're like, it's just bad luck, or who knows? And then people stop trusting their body, and they've given all their power over to the doctors or, whoever it is that's going to fix them. Right. And so there's these limiting beliefs that develop. And I never thought about that. I knew that I didn't like that about medicine, but it's like what you're saying is true, that some of these limiting beliefs are actually reinforced or created by our traditional healthcare system. And you said this earlier in the episode, it's like, you're the healer, you're the medicine. And that's one of the things that I love about my practice now, is that I approach it, I'm not the healer. My clients are, they're their own healers. I'm just helping them open and guiding them in their own process. And it's different for everyone. And that's why I love there's so many different tools that people can use. But Psyche and the specific way that you're doing with subconscious integrative therapy is just beautiful. So I'm so glad that that we were able to meet and talk today and to share with my audience. And if people are interested in your work or interested in working with you, how can they find you?
Yes, you can find me on my website, ellierichter.com, and or Instagram. That's the only social media platform that I use, Ellie Richter, really easy. And you can just send me a message or schedule a free conversation and we can talk. And if I may, I would really love to share. I think we're really moving into a new paradigm. I have no idea how we get there, but I'm so here for it. And I think it's the paradigm that exactly you're in, that we are our own healers, and that the expansion of consciousness is what's going to help us truly access the magic that's in our bodies, and that disease is our bodies and our spirit's way of guiding us. I've dealt with a lot of chronic pain and disease in my own life, lots of pain, and pain has been my greatest teacher. And it wasn't until I deeply surrendered into the pain, I allowed it to teach me, that I recognized that disease and pain is not a punishment. It's not because you did anything wrong. And it's also not the end of your life. It's usually a great awakening. And if we shift the paradigm and our belief, looking at that and welcome it a little bit more and get out of this paradigm of pathologizing and fixing into the paradigm of listening and understanding and getting curious and taking back our personal power, I think it's very exciting what's coming. And I know that's hard to hear when you're in it and when you're in pain. And I'm not saying you need to adopt that mindset. This is just something I come to and I find very empowering, to look at disease and physical feedback that way, and to get curious of what our body is telling us. And cancer from a spiritual perspective, I've worked with a lot of people through cancer. It's always very interesting. And there's a lot of beautiful, if you're open to it, opportunity in the journey for your healing, for your growth, for your spiritual journey. And the people that have asked that question or gotten curious about it has been rewarded with a depth that I can't even describe,
Yeah. Well, and in Chinese, cancer is a crisis, but crisis is represented by two symbols. The first symbol is danger, and the second symbol is opportunity. And like any crisis, there is the opportunity for growth, and it's not what happens to you, but what you take from that and how do you use it. And that's actually why I love being with people who have cancer, is because shit gets real when someone is facing a life-threatening illness. And I love being in that space because there is so much opportunity for positive change and complete transformation of your life. And it happens for different people at different times during their journey. But I think that cancer or any other serious illness like that really changes people. And when you can see it as like, okay, yes, there's danger. So it's like, deal with the danger, but then see the opportunity that what am I taking away from this? Like, what is the lesson that I want to take forward out of this experience that may be painful to go through that pain, is the transformation. So I love that you shared that. Thank you, Ellie, for being with me today. It was truly my pleasure to meet you and spend time with you.
Same. Thank you so much, Dr. Katie.
Thank you for joining me on Born to Heal. It's been a privilege to share this time with you, and I hope that today's episode has offered you valuable insights on your journey toward optimal health. Please consider subscribing, sharing this podcast with your friends, and leaving us a review. To learn more about how you can work with me, please visit katiedeming.com. You can find additional resources in the episode show notes linked below, and remember to join us next week as we continue to explore more holistic approaches to healing. Until then, this is Dr. Katie Deming, reminding you that just like me, you were born to heal. What if healing cancer didn't have to be so overwhelming and confusing? What if you could access a higher level of consciousness to accelerate healing? And what if you had a clear roadmap to follow, a path to lead you out of the fear and uncertainty? Hi, I'm Dr. Katie Deming. As an oncologist who's cared for thousands of patients, let me guide you safely through the fog. My 6 Pillars of Healing Cancer workshop series is now available, and it's not too late to join. Choose from a range of powerful workshops, each designed to support your healing journey, covering nutrition, emotional well-being, hydration, physical practices, the mind-body connection, and spirituality. Select only the workshops that align with you, or for a limited time, buy the entire bundle and enjoy significant savings. Don't miss this proven holistic roadmap to clarity and deep inner calm to support your healing process. Check the link in this episode's description to learn more and sign up today. Remember, you've got this.